Was wondering, in a lot of other industries, you don't have these intermediaries that are negotiating prices, and you get this competition and nice market dynamics. Um, Here you have payers and PBMs that are in the middle, and value-based pricing would be in the vein of the negotiated prices as well. Might there be an opportunity to create a marketplace that the pharma companies come in and post their prices, and so maybe starting in self-pay consumers, there's just a much simpler infrastructure, and then you won't have that 40% of the cost of a drug.
My sense is we're going to see disruption in this marketplace for a lot of the reasons that you mentioned. Increasingly, we're seeing states do reverse auctions with their pharmacy benefit manager to try and lower the cost, because quite honestly, the value that is created in the system is created by the creation of the medicine, but 40% of the price is getting eaten by others in the supply chain. So I think there is more to be done to squeeze some of the costs out of that supply chain. The good news about consolidation in the PBM and insurance industry has been significant competition, right? That has led to these really, really big rebates. That's all great if patients are benefiting directly from them. But today those rebates and discounts are kept, and they're kept because Matt's companies want to lower premiums, a laudable goal. But for a lot of patients who rely on medicines, the end result is they're paying much more so than what their insurance company is paying for that medicine. We think that needs to change.
I think that's not commonplace within the industry. So think about, well, one thing that's important to remember is the market dynamic that you're talking about. It can't be a true market when you have a government-granted monopoly through the patent system or through market exclusivity. So that's one point. The second point is that the whole rebate discussion, rebates were actually created by the pharmaceutical industry many decades ago as a way to discriminate against different classes of trade. And I won't get into all the details around that, but it was really an artifact of the pharmaceutical industry that was created. And when you think about the prices of products, let's say there was a rebate of 20% on a $1,000 a month product. Do you think a patient feels any better if they were paying $800 a month instead of $1,000 a month? Yeah. Going into the pharmacy, it really starts with the price. And if prices were lower, we wouldn't have this problem.